Hello everybody. Due to some personal reason, I cannot attend this class tonight, so I do a video about this topic, and you guys can watch it in the class. My part is the blood flow to the pulmonary and its distribution. It's kind of simple, so I will talk quickly, so you guys can easily understand. Okay. So let's go into the topic, the blood flow to the pulmonary and its distribution. So first, uh, as we had know, the blood flow from the right ventricle to the pulmonary artery, going to the lung, and at the lung, the blood exchange oxygen and carbon dioxide with the alveoli, and after that, the blood is fully oxygenated, and then it's go to the left atrium and go to the right atrium, right ventricle, and it's going to the pump the blood into the circulation. So it's very easily to understand this concept. But due to some reason, for example, when you're go into a high mountain, you will see that the oxygen will be decreased in concentration. So the oxygen tracer concentration in the alveoli will be decreased. So due to the decrease in the oxygen in alveoli, so what do you think? Uh, if there are no mechanism to điều hòa, it will lead to a very severe condition called systemic hypoxia. In order to for to easy to understand, I will explain. Because when the blood is pumped into the lung and the alveoli have less oxygenated, POC, PO2 or FNAPOC will be decreased, so it cannot exchange the oxygen from the alveoli to the blood. So the blood is full of carbon dioxide and less oxygen, and it's gonna cause the blood flow to the left ventricle being mixed, or we can call it by another name called micro shunting in the lung. It's like left to right sun or right to left sun in the heart, but instead of sun in the heart, it's sun in the lung. So it's called right to left sun in the lung, but it's a micro shunt. Okay, so due to that shunt, the mixed blood will go into the systemic circulation, and it's gonna cause the systemic hypoxia, and it's gonna cause many problem. So our body doesn't want to doesn't want to bị cái này, okay? So we need to have a mechanism to điều hòa this mechanism. Okay, so what do we do? It's in a very logical thinking. You will easily can try to stop it from happening. That's we're gonna vaso cause the blood vessel in this area to constriction. So, or in another term, is vasoconstriction. Due to that constriction, the blood cannot go to the alveoli. So the blood will go into another alveoli, which have a high PO2, so it can exchange oxygen more efficiently. So it's gonna make the blood not mixing. So it's gonna make the circulation red and beautiful again, right? So what do? We will cause the vasoconstriction. The vasoconstriction in this alveoli, but in another alveoli, the blood flow will increase to another alveoli which have a high PO2, and this gonna have the body escape from the hypoxia systemic. Okay, so what's the mechanism behind this concept? It's very easy, but actually there are no evidence about uh, what is the main mechanism behind this concept, but it's some theory about this. The first thing is the endothelium in the blood vessel will be decreased in NO synthesis due to the hypoxia, and as you know, NO is the substance which have the blood to dilate. So if there are no NO, the blood cannot dilate, and it can cause the increase the calcium inside the cell, and it's called vasoconstriction. Another mechanism has been researched is that the hypoxia will inhibit the potassium channel. As we know, potassium will go from outside into the inside through the potassium channel. But if the potassium channel is inhibited, they will there are some cell signaling pathway. It will open the calcium channel. So it's called the calcium outside the cell go into the calcium inside the cell, and it's called increase the calcium channel, and it's called vasoconstriction. There are some mechanism, but there are no evidence behind this. You just know this because there are some hypotheses. So overall, this will cause vasoconstriction, right? So it's quite easy to understand. Okay, so I have a case for you. You are called to assess a patient admitted with chronic obstructive pulmonary disease or COPD. A physician has just examined the patient and tell you that physical findings include obvious pulmonary disease, distended neck veins, angioedema, and hepatomegaly or enlarged liver. Arterial blood gas value indicate chronic hypoxia, and the chest radiograph show hyperinflation of the lung with right ventricle enlargement or hypertrophy. The admitting diagnosis is COPD with right ventricular hypertrophy. So my question is, what's the relationship between the patient lung disease and cardiac function? So you see a lot of feature here. Is COPD, is distended neck vein, angioedema, hepatomegaly. So what do you think about the relation between the lung disease of this patient and the cardiac function? Because as you can see that the cardiac function is quite some malfunction, because there are some clinical features you can see here is like distended neck vein, angioedema, and hepatomegaly. So what do you think about this relationship? So I will let you some time to think. It's quite easy, right? There are some many clinical feature really điển hình to this type of concept. And how can you relate the relationship between the lung disease and this cardiac function, and use the concept as I previously said to you about the hypoxia vasoconstrict mechanism. Okay, I will explain the concept for you. So as you see, COPD is chronic obstructive pulmonary disease, or in another name in Vietnamese is viêm phổi tắc nghẽn mãn tính. So in this type of situation, the COPD will cause the alveoli destruction anatomically, right? Alveoli will be destruction, and the membrane between the alveoli and the blood vessel will be decreased, so it's don't have many surface to in order to exchange gas, so it's called hypoxia. So as I said earlier, hypoxia will cause vasoconstriction, but COPD is a condition where a large number of alveoli in the lung will be destruction, so it's called the vasoconstriction in all over the lung. So as you can predict it, the pulmonary artery pressure will increase due to this vasoconstriction. Due to this large vasoconstriction, the pulmonary artery pressure will increase. The pulmonary artery pressure increase will cause the right ventricle hypertrophy, because the right ventricle needs to pump the blood from the right ventricle to the lung in order to exchange the blood. exchange the gas. But pulmonary artery pressure is increased, so the right ventricle need to increase the muscle mass, or another term is hypertrophy, in order to have an efficient blood pump. But in time, this hypertrophy mechanism cannot sustainable, so the right heart will fail, or in another term is right heart failure. The right heart failure will cause the condition called pulmonary. I don't know this, maybe France like Khổng Minh Đức can pronounce it, but it's maybe called pulmonary. I don't know, but in Vietnamese it's called tâm phế mạng. This is condition where a lung disease cause the right heart to failure, so it's called pulmonary. So I have a question for you, that's how to treat it. So tâm phế mạng là một cái tình trạng mà COPD làm cho tăng cái sức cản hệ thống của sức cản của động mạch phổi và dẫn tới là suy tim phải. Vậy thì làm cách nào để có thể chữa trị nó? How to treat it? So it's quite easy. So I will talk right now that you can understand the mechanism. So from the mechanism, we're going to develop the treatment, right? So the COPD caused hypoxia, so we need to treat the COPD, of course, but how we can decrease the hypoxia? How can we decrease the hypoxia? We can give the patient oxygen, so it's make them can escape from this hypoxia condition. So there are no vasoconstriction, there are no pulmonary pressure increase, there are no right ventricle hypertrophy, there are no right heart failure, so there are no pulmonary. So that is the treatment. Of course, they are not just that simple, but overall, they are the concept behind this, how to treat the pulmonary. Pulmonary is just a clinical feature. It's not a disease. Because many disease of lung disease can cause hypoxia, can cause alveoli destruction, and it can cause right heart failure. So pulmonary is not a disease. It's just a feature. It's just a clinical symptom. So you just treat the symptom by stop the hypoxia. But if you want the patient to never suffer from this type of symptom again, you need to treat the cause of it, or in another word, you need to treat the COPD. So that's the end of my presentation. Thank you for listening.